Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hi, everyone. Dr. B and Dr. G here, and today for another episode of our AMG Vitality Vault podcast. So, Dr. G.
Yes.
What socks did you bring today?
So,
please tell.
Today, one of my favorite characters of all the Marvel Universe, I am wearing my Hulk socks. There it is. Look at that guy. Look at that guy. Hulk socks. Now, Hulk is pretty strong. And you know why the Hulk is strong? Because he takes care of himself. He goes to see his doctor.
Okay.
Regularly gets his checkups, and he gets his blood work done. So today we want to talk to you guys about blood work and why it's important when you are, going through life to see your physician, get blood work, and we want to make sure you guys are empowered and fully understand what is in the blood work. So we're going to start off with the basic metabolic panel. This is the one that primary care physicians like myself and Dr. B, these are the ones that we order on the regular. Right. In this blood test, we're measuring basically the essential components or the electrolytes in your blood, looking at the balance in those electrolytes as well as your kidney function. And this can help us to diagnose many conditions, whether it be issues with glucose metabolism leading to diabetes, kidney issues, acid-base issues. It's a good starting point for us as physicians to be able to help guide you as patients on the path of health and wellness. So it's a pretty cool one, and everyone gets a BMP. It's called BMP or electrolyte panel in the hospital, but not many patients fully understand what each of those numbers mean. So we kind of want to dive in. And at least educate.
So let's take a look at the different values, the different numbers on the BMP.
Yes.
And talk about a little bit about what each means. Some of them you'll be familiar with. Some of them you may not, even think about looking at when you get your lab results back. So first up is glucose, which is basically our blood sugar levels at the time. And this will differ whether you're fasting or non-fasting. Glucose is a primary energy source for the cells. And if it's elevated, it could mean that you have some dysfunction in your blood sugars, whether it be insulin sensitivity problems, prediabetes, or it could mean that you have full-blown diabetes. So it will indicate the need for further testing. If it is low, it could suggest hypoglycemia episodes, maybe a reason why you're feeling certain ways like during the day, or other metabolic issues as well, which will then need further workup from your doctor. For calcium levels, calcium is important for nerve, muscle, and heart function. And if you have higher levels, it could actually point to parathyroid disorders. If it is low, it could be pointing towards some kidney disease or some bone disorders. So again, it's a level that if it's low or high, means that you need further investigation. Once in a while, there are some one-off times that it could be a little bit elevated or low just based on, maybe something in your diet recently, maybe lab error, or, just something else that might be affecting. So sometimes we repeat these before going into further testing to make sure that those values were correct.
Actually, we do tend to repeat. If something is a one-off abnormal, without a proper rhyme or reason. So we do repeat those tests. So it's always good to have like a backup or a second test done, especially if something is not the way it should be.
Right. Because a lot of these, like in the BMP, a lot of these values do go along with other values in there. So if it's a particular pattern that we notice, then we're like, okay, maybe there is something going on. But if it's one value and everything else seems to be good and it really doesn't follow anything in terms of any disease states or so, then we definitely have to repeat.
All right, let's talk about sodium and potassium, two really important cations actually in the blood. So with regards to sodium, everyone knows about sodium, right? We'll talk about low sodium diets. We talk about not taking in too much sodium, and there's a reason for that. Now, the role of sodium is fluid balance. So basically, sodium pulls water, and sodium is also important for muscle function. Abnormal levels of sodium can be disastrous, though. So if your sodium is too high, that typically is pointing towards most likely a dehydration type disorder or kidney issue. If your sodium is way too low, we see this a lot with adrenal dysfunction. And we also see it in certain medications too, can cause you to have what we call hyponatremia. You can also see low sodium in people who have abnormally high blood sugar levels. Because when you have excess blood sugar, you get more water pulled into the body and you hyperdilute your sodium. And people who have way too low sodiums can end up with issues of seizures, coma, and sadly, some people death if it's not caught early enough. Now, potassium, another very important cation. Its function primarily is in muscle and heart regulation. Why? When your potassium itself is a little too high, when there's imbalances, when it's too high or too low, you get dysrhythmias. What that means is the electrical charge in the heart goes off, and you can end up with all sorts of different kinds of cardiac abnormalities because of the potassium balance not being where it needs to be. Now, with regards to potassium, we get potassium from foods. I know kiwis are a good source of potassium. Everyone knows about ripe bananas as being a good source of potassium. So those are important to make sure you have. So it's balance is key. With these cations, balance is key. And if you do blood work and you see they're off, ask the question. Now, a key point about potassium, you can see abnormally high potassiums if the blood is hemolyzed. What that means, when the blood is ran in the lab, right, sometimes those little red blood cells, they bust. And when they bust, they release their intrinsic cations, and that kind of messes with the measurement of the potassium. So you want to ask yourself, and your doc will do that too. We'll see it and check with the lab. Hey, is this a hemolyzed sample? And most labs, they will tell you, yes, hemolyzed, you got to repeat it. And if that's the case, just repeat.
Next on the list here is the CO2 level, which is a carbon dioxide level in the body. And this is more for acid-base balance. And it's indicative of mostly of kidney function, because the kidney is responsible for balancing a lot of our electrolytes and, putting out stuff into the urine when we have too much, reabsorbing when we need. And also, this level can actually signal that you're having some respiratory issues. So basically, if you're not blowing off, as we take in oxygen, we blow off CO2, carbon dioxide. If your lungs are not working as well, it can actually retain in the body. And again, with this, the kidneys can actually jump in and help there. But when you have dysfunction of any one major body system, it can definitely reflect in the CO2 level. So it's, it's not as straightforward, the CO2 level, but it's something that if it's perpetually high or low, should trigger more workup or looking into, especially if there's no obvious cause for it at a time. Your chloride level is, again, another electrolyte, helps with fluid and acid-base balance. And if it's low or high, it may point towards not taking enough water, so dehydration. It could be a sign of some kidney dysfunction or disease. It could be medication-induced as well, too. Just something that balances. And the chloride tends to go along with the sodium. And so a lot of times when we see sodium being low, we see chloride being low as well, and the other direction as well. So these electrolytes do work hand in hand with each other. You could see that the kidney has a lot to do with balancing. And so it does give a lot of insight. especially, as I said, if it's following a particular pattern in the BMP.
Yeah, the kidney is a really cool buffering system in the body. And to Dr. B's point, the chloride is very, very important. When your chloride is too high, they call that hyperchloremia, and that's a sign of most times dehydration.
Yeah.
And when your chloride is too low, that's hypochloremia, and that's a sign of metabolic issues, which could mean kidney disease too. So it is important to keep. I know a lot of times people ignore the chloride, but it's good to have an eye on it, especially for your physician, because what we will do as physicians, we'll do what we call an anion gap, where if we're worried that you're having some level of acidosis or alkalosis, we'll do some math with the chloride and be able to figure out, this is what's going on, and make corrections. And we tie the chloride in with the CO2, which truly is called bicarbonate, and that's what it's called, and we'll tie that in those two to be able to get a proper calculation of your acid-base anomaly if you do have one. So it's cool to know these numbers and to see how they fit in with diseases. So it's important that you, when you're analyzing your labs, ask the questions, and see if there's something else going on that you're missing. Diving deeper into kidney function, BUN, creatinine, and GFR. So the BUN, or the bun, as patients tend to call it, it's not sticky and it's not sweet, but it's a good bun to keep an eye on, right? So the role is
You don't want it too high, though.
You don't want too high of a bun. No. The role of the BUN is actually a waste product that's filtered by the kidney. So we're measuring how the kidney is functioning using the BUN. High levels typically means that the kidney's under some kind of strain. With the creatinine, also another waste product of muscle metabolism, and is filtered by the kidney. So these two in concert help us to give a high level view of how your kidneys are doing. Okay. Now, the higher the creatinine, typically it means the more strain the kidney is under. Now, there is a caveat to this. So if you're a guy, and the more muscle mass someone has, the more you're going to have a slightly higher than normal creatinine. Doesn't necessarily mean you have full-blown kidney disease. All it's telling me as a physician, when I look at it, if you're 6'5", 200 pounds, and you work out heavily, I should expect to see your creatinine a little bit higher than someone who is, let's just say, 100 pounds, a little bit older. So it's something to be mindful of. And I know your docs will do that too. Be like, well, this is a normal for you because of these metrics that you have. So the one we definitely want people to pay attention to is the GFR, or the glomerular filtration rate. Now, this one you'll see in a lot of lab reports as eGFR sometimes, which is like an expected or estimated GFR, which is a calculation. This tells us how well the kidney is filtering, how efficient it is. Reduction in GFR happens as we age. We do see it go down. Now, the normal GFR typically is anything above 90. That's typically the normal GFR. But what we do know is that as we all get older, that function slowly begins to reduce. Now, there are certain things that can worsen GFR, so we got to really be careful. But for my patients out there, be careful. Because what I noticed, Dr. B, is a lot of the labs that we see now, they have the GFR, and what they'll have is a little greater than sign 60. And so people will see a GFR and they'll see themselves at 65, 61, 63. And they think that's normal, when technically, based on the Kidney Disease Foundation, that's not normal. If you look at the spectrum of kidney disease, when you go from stage 1 to stage 5, 5 being dialysis, so 1, there's a range there. Now, to get into 1, your GFR is already below 90. So think of that. So when you look at your lab work, go straight to GFR and ask the question, hey, why is my GFR 62? I'm 50-something years old. I'm pretty healthy, depending on who you are. And ask the question, because there are certain things that can reduce GFR on a whole. But we know for a fact, normal GFRs are above 90. So ask the question. It might take some investigation by you and your physician to figure out what's causing your GFR to be low. If it is the aging process, yes. Or more typically, it's a disease process that you're dealing with.
So some docs actually refer to GFR as a percentage. So if you've not heard the GFR like those words before. If they say, if your doc told you your kidney is functioning at 70% or 60%, a lot of times, although it's not quite a percentage, but when you think about it, so younger patients, younger people actually have GFR of over 100.
Yeah, they do.
I remember when I first started getting my blood work, I think my GFR was like 130 or something like that. And of course, like we spoke about with age, it does come down some. But so at some point, usually a GFR is over 100, but the typical average healthy GFR is right around 90 or so. So it's not uncommon for people to say it as a percentage. So if you've heard, your kidneys are functioning less than 60%, and that's where you think about, okay, there's something going on. That's a GFR Dr. G was saying of lower than 60. But you don't want to wait until that number drops. If you notice that consistently, not just a one-off, but sometimes we can be a little dehydrated, especially when you go in for fasting labs. So I always tell my patients, even if you're fasting, drink at least 2 to 3 glasses of water in the morning, hydrate, wake up that kidney so that your BUN creatinine, which usually the GFR is measured from, that those are healthy and reflective of what you've been doing in the past few days and not, like shriveled up, not dehydrated.
So we don't want kidneys turned to prunes.
Not at all.
No, we don't want prunes for kidneys. No.
Not at all. So let's look at some common conditions that can cause lowering of GFR. So aging, as we said, natural decline
that
in
disease
GFR.
of aging. We have to find a cure for that. We have to find a cure for that.
I know. But, there's some things to combat that. That's probably for another podcast.
That's right.
Hypertension. So when you have increased pressure in your blood vessels, these blood vessels are actually leading towards these little glomeruli, which is very, very tiny blood vessels in the kidneys that are filtering our blood. And you have high pressure in those glomeruli, it's going to damage the cells, and so that reduces your GFR. So we see this in uncontrolled high blood pressure or hypertension. Diabetes can lead to, so the high sugars going into the kidneys can actually damage the cells there and what we call diabetic nephropathy. And that in turn leads to reduced GFR.
Now, when you look at the other ones, obesity, that's a big one. Causes initial hyperfiltration, which is basically increased filtering in the kidneys. And that, obviously, you put a strain on the system, it's going to get damaged. And then we look at acute kidney injury and chronic kidney disease, which can be sometimes genetic, the different disorders that predispose people to have these conditions, and where we just see the kidney function decline, over the course of months to years, based on how aggressive this inflammatory disorder is. Because let's face it, it's all inflammation. Everything we talk about, it's all inflammation, hurting your 2 kidneys that you have. So protect them as best as you can. Now, a big one that most people don't realize is medications. So a lot of over-the-counter and prescribed medications can cause issues with damage in the kidneys. Some of the more common over-the-counter ones people don't realize are the NSAIDs. When you look at over-the-counter ibuprofen, over-the-counter naproxen, which is Aleve, just taking those on the regular is not the safest thing to do for your kidneys. So you want to really, really be careful. Not because it's over the counter doesn't mean it's completely safe. And then the other side is prescribed medications that we prescribe all the time, for whether it's antibiotics or even blood pressure medications. All those can negatively impact the kidneys and the GFR. And if not caught early, can lead to long-lasting damage that sometimes is irreversible for some people.
And especially going back to the NSAIDs, you need to be cautious if you're on any medications that are anti-inflammatory for like arthritis or joint, because a lot of those can be in the category of NSAIDs. And some people don't realize that if they're on certain medications like diclofenac, meloxicam or Celebrex, they're in that class, and they shouldn't be taking extra ibuprofen or Aleve, Advil. These over-the-counter NSAIDs can add to, so, while you're being prescribed a safe dose of these, when you add these over-the-counter ones, and it does increase the risk of side effects. So, always ask your doctor if you're not sure. is it safe for me to take this? Is it safe for me to take, Advil with this, Tylenol, whatever it is over the counter? Be sure to ask your doc about that.
Yeah, even some of the antacid ones like the omeprazoles, those are coming out to cause some significant kidney issues with long-term use.
Right.
So imagine that you're taking over-the-counter naproxen, right, for your elbow pain. Then your doc puts you on meloxicam, rightfully so, because you have, let's say, rheumatoid arthritis. And guess what? You have acid reflux. So I just throw some omeprazole in there too. And then in addition to all that, you got a cut in your foot, you're going to need antibiotics. I'll put you on a penicillin-based drug. Boom. So now we have 4 things that your kidney is saying, what is going on? What did I do to you? So be very, very careful with the medications. Always ask, how long should I take this? And do I really need to be taking this?
Absolutely.
So why should you monitor your BMP? I think we discussed that at length today, right? It does give you some good insight into your metabolic health, which is very, very important. A lot of us forget about that. We're looking for early detection. Dr. B and I are firm believers in early detection. You fix things now while the forest is burning on one tree, then you won't have to fight that 3,000 acre fire. You fix it now or you attack it now so you don't need to fight that fire later.
Yeah.
And as always, when you get blood work, ask the questions, dive deep into why certain things are the way they are. Approach it with an open mind and with a learning mindset that this is your life. This is your blood.
Absolutely.
This isn't mine. We are here to guide you, to empower you so that you can be able to make the right decisions for your health as you progress.
Yeah. As you can see, it's a big representation of a kidney function. So we only have 2 kidneys, so we want to keep them healthy.
Everybody gets 2. Well, no, I shouldn't say that. Some people are born with 1. And then there are also some maladapted ones that happen. So,
well, you know what? Kidneys are important.
yes.
They filter a lot of, toxins. They help with balancing, electrolyte balancing in the body. They keep you alive. So we want to keep them alive.
So, hope you guys had fun. Hope you guys learned something today about your basic metabolic panel. We love educating, and we just want to say thank you for those of you watching. And remember, like and subscribe to the show, share with your friends, and we want to bring more and more knowledge that empowers you as the consumer. So, Dr. B, any final thoughts?
Well, hopefully we all have happy kidneys, and we'll catch you next time in another episode of the AMG Vitality Vault.
See you guys.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.